Hello, thank you for meeting with us today. We are the DRHA Hospice Business Development Team. We are Lisa, Melissa, Kim, and Kim. My name is Lisa, and I'm one of the members of the Hospice Development Team. DRHA has asked this team to determine the feasibility of adding a hospice program to its already established home health program. We were tasked to see if the hospice program would increase revenue and be financially sustainable. In the recent year, DRHA has noticed a decrease in revenue in the home health program, but also has identified the need for an additional hospice provider for the community due to a rise in hospice referrals. The home health program contracts with only 3 of the 5 major health insurances in the area, which has contributed in the decrease of revenue. Currently, there is only one hospice providing service to the community. This makes for a great market for DRHA to move into. A little background into what hospice provides. It provides compassionate end-of-life care to patients and supportive care to families. Through an interdisciplinary group of providers, patients are provided with symptom management, complex case management, advanced care planning, end-of-life education, and bereavement services for families. And implementation for the hospice program will be June 1st, 2015 until July 5th, 2015, with the anticipated launch date of July 6th, 2015. The first week, June 1st through the 7th, management will be hiring staff and planning education for current and new staff with the nurse educator. Marketing announcements will be sent out by June 8th to the appropriate patient population areas, including within the hospital and the community. Any orders for equipment, supplies, and capital items required will be submitted prior to June 19th. From then on to July 5th, preparation, reevaluation, and revising goals will continue. Hospital case managers will be notified, so referrals will be appropriate. Management, the financial department, and upper administration will be continuing to meet to develop and revising goals, and to continue a working relationship. With all this complete, July 6th should be our launch date. I will now hand it over to Melissa.
Hi, thanks Lisa. My name is Melissa, and I'm here to discuss with you the projected revenue and expenses for the first year of business for the hospice program. When this team was tasked to develop this project, we were asked to determine whether this new venture was even feasible. I have been working with the financial and billing departments, as well as reviewing case management and social work records to develop the business plan. Budget plan. Upon review of records, we were able to determine the number of hospice referrals our department has received over the past year. Using this data, we have approximated the number and type of patients that are likely to utilize this service. The majority of patients referred were covered by Medicare, which data shows are over 80% of the patients who do utilize hospice nationwide also. So we anticipate that will continue with our service. With Medicare coverage for patients is guaranteed. There are also benefits for Medicaid patients that's guaranteed, and the 3 private payers that DRHA already contracts with also provide a hospice benefit. As you may know, hospice does provide care regardless of ability to pay. However, per the National Hospice and Palliative Care Organization, the NHPCO, this is typically only about 0.9% of patients, so we don't anticipate this to be a hindrance to the success and financial stability of our program. Due to utilizing the home health program for support, the startup will save in costs with shared office space, supplies, and resources, including staff. Both programs will report to the already existing nursing director and manager. There will be some new positions to fill, including a medical director, social worker, educator, and chaplain. Our care model that we've designed is based on recommendations put out by the NHPCO. So we know that it's a model that works and is considered successful. For this care model, we will require an additional 12 RN FTEs and 6 FTEs for aides. This staffing will support an average daily census of about 36 patients, which we do not anticipate surpassing within the first year. Full-time RN positions will be salaried plus mileage. This will help manage costs as patient needs and acuity can change unexpectedly. We have planned for capital projects totaling about $50,000, which will include office space renovation to make the workspace appropriate for the increase in use, and a purchase of computers and other equipment. Other upfront costs will include marketing and supply purchases. Expenses for fiscal year 2016 are anticipated at about $1.1 million with a revenue of about $1.3 million. This comes out to a net revenue of about $175,000. Let me show you a little graphic. I need to highlight the revenue and costs. So here you can see as a simple graph, the blue line is our anticipated revenue and the red line is our anticipated costs. At the very initial startup, as you can see, that costs do outweigh the anticipated revenue. However, quickly the revenue does increase above a nice margin above our costs, and the costs are expected to level out by the end of the fiscal year. So don't anticipate there being an issue there with costs. Financially, we anticipate the addition of the hospice service is feasible, and with careful planning and management, it will continue to be a stable source of new revenue for the organization. So I'm going to turn it over to Kim, who's going to discuss more of the benefits of the hospice program.
Thank you, Melissa. My name is Kimberly, and I would like to present to you the expected outcomes and benefits of having a home hospice service for both the DRHA and the community. First, the community. The community itself would have another hospice and palliative home care service to choose from. Plus, patients and families can expect a decrease in hospital readmission and unwanted hospital deaths. And lastly, the hospice home service will ultimately help those patients wanting to be at home to receive compassionate and respectful end-of-life care. Now, as for the DRHA, it can expect a growth in earnings and revenues and a higher cash flow, as Melissa has demonstrated. Also, most hospice referrals are Medicare patients, and Medicare does pay. But overall, the most important thing would be that the hospice service would encompass the same values as the DRHA. It will reflect the mission, vision, and value statements by being a leader in hospice care in the community that provides education to patients and family about end-of-life care. It will be a positive benefit to the community and provide a caring, respectful, and compassionate service to those in need of hospice care. Lastly, this hospice service will demonstrate financial sustainability, quality patient care, education, and serve as an outreach of support to anyone in need, which are all the qualities found in the strategic statement of the DRHA. Thank you, and I'd like to turn it over to Kim.
Hello, my name is Kim, and I'm going to present our marketing brochure. Being that this is a new venture with home health, we will target the population of patients who have exhausted or declined treatment options, as well as family who want quality, comforting, in-home care for their loved one who has been given less than 6 months by their provider due to end-stage disease or illness. We have budgeted for marketing in our business plan and expect a streamlined transition for the partnering of home health and hospice so that community populations that are served by DRHA will continue to be provided quality, caring, and cost-effective services. Our brochure consists of a colorful 4-page informative collateral that will be distributed to physician offices, adult centers, case managers, church offices, and social workers within the surrounding DRHA community. Taking a look at the brochure, page 1 informs the reader who we are and gives our tagline of home hospice care for you and your loved one. Page 2 displays the support services available to the hospice patient, along with information about what we do as a hospice team. With the assistance of our hospice team, care is delivered to the patient in the comfort of their chosen environment. Typically, the patient chooses their own home. However, care is also available for residents in assisted livings as well as nursing homes. Page 3 discusses eligibility for the hospice program, financial information, bereavement services, and information about advanced care planning. We also touch on the composition of our hospice care team. Page 4 gives a wrap-up of the brochure and lets individuals know to contact our hospice team for further information. We provide a phone, fax, and website for further information as well. We also stress to individuals that they are not alone on their journey and that we are there to support them with end-of-life comfort and care. Thank you.
And we'd like to thank you guys for your time. We do have some brochures printed up if anyone would like to pick some up to take a look at them, and we are available for questions. And again, thank you for your time. Have a great day.